Dr. David Grenache, thank you for making some time with us. How does TriCore fit into the testing system that New Mexico as a state has in place?
Well, TriCore is a regional reference lab, a clinical laboratory that performs laboratory tests on patients all across New Mexico. We have our main operation here in Albuquerque, but we also operate clinical laboratories in hospitals around the state.
Okay. As we moved through this process, TriCore has ramped up its ability to test significantly. Can you talk to me a little bit about that, including adding platforms for testing?
Sure. So we started testing for the COVID virus, the nasal swab test that you see so much about, in early March. And it was obvious, we knew it from the beginning, that we wouldn't have enough capacity to meet the demand for testing with our current machines that we have. So we quickly ramped up capacity in order to meet up with demand. And now we're able to perform about 3,000 tests a day.
Okay. As we return to work, how important is testing to New Mexico and to weathering the pandemic?
Testing is always going to be important throughout the pandemic, until which point we get to a better understanding of what we call the prevalence of infection, how many people have either are currently infected or who have had the infection and have recovered. And we're hoping that recovery means that you would have some immunity to reinfection. But moving forward, testing will be important to identify individuals who are infected but are asymptomatic and should stay at home in quarantine until they are no longer shedding the virus.
Okay. Before we started, I was looking at some of the numbers, the testing numbers that TriCore has shared with people. It looks like you've done probably by this point more than 70,000 tests in evaluating them. About a month ago, it looks like maybe the positive rate was somewhere between 5 and 6%. As you've really ramped up your capacity in these past 2 or 3 weeks, it appears that that's gone down to somewhere around 3%. What can you tell me about those numbers? Is that significant at all?
Yeah, currently our positivity rate meaning the number of positive samples against the total number of samples tested is around 4%. And I think throughout the pandemic here in New Mexico, we've seen fluctuations around that 4% average. But keep in mind that that TriCore isn't the only laboratory that's doing testing. So it's we do most of the testing in New Mexico, but the state health lab also is doing a fair number of tests as well. But all the test data are aggregated and put on the Department of Health website every day.
Sure. We have I think, a tendency to want to infer things from the numbers that we see to better understand them or feel like we have some sort of a grip on what's going on. Is it fair to infer anything from these numbers?
Well, I still think it's maybe a little bit too early to infer a lot. There's lots of modeling and predictions that are taking place. But the further you get out in time in a predictive model, the more uncertain the model becomes. I don't think you can I think what you can read into the positivity rate today is that it hasn't been rapidly increasing in New Mexico, and that's a good thing.
It's an indication that the disease just isn't spreading faster, I guess.
And I think that the restrictive measures that the governor put in place to help slow the spread of the disease were very effective.
Okay. So there are two types of tests. There's the do I have it and the have I had it test.
Right.
You mentioned the first one with the nasal swabs, the do I have it test. The second one, that's called serology. Is that right?
Correct.
Okay. What that detects antibodies. And right now, as you mentioned, we'd love to know whether or not having antibodies gives you some sort of immunity. Without knowing that, how do we peg the usefulness of the serology test?
That's a really important question. I think we can look at the usefulness of a serology test, which is, and just to be clear, a serology test for the novel coronavirus is detecting antibodies that our immune systems make against the virus. Right? And antibodies are proteins that, in many cases, will confer immunity. Sometimes that immunity is lifelong. You can think of a measles vaccine, for example, right? It makes us immune to measles for really the rest of our lives. Other times that immunity is short-term, and you think about getting a seasonal flu shot. It makes you immune for a short period of time, but then that goes away. And right now, we don't know for certain whether or not antibodies that we make against the novel coronavirus will confer short or long-term immunity, or if they'll confer any immunity at all. So when we look at this type of serological testing, I think we can put it, I put it into one of two buckets. The first bucket is testing an individual to see if they've had the infection in the past. And right now, that's really all a positive test will tell you, is that you were infected in the past. But it doesn't really doesn't provide any really valuable or actionable information. And the other bucket of testing would be from the public health perspective. Antibody testing can be useful in what we would call a seroprevalence study, right? If we could test a certain number of the population, a certain number of people, and identify who has antibodies and who doesn't, that would give us a good idea of the infection rate, right? How widely spread the infection was, particularly among individuals who were sick and didn't seek care and didn't have a viral nasal swab test, or people who were infected but never had symptoms or had very mild symptoms. And so doing that type of widespread antibody testing would inform us about how widespread the infection was.
Okay. And with that information, as you said, you can sort of measure where it is in the population. Is that also useful if, say, a month, 2 months, 3 months down the road, we discover that there is some sort of immunity that's passed along that the presence of those antibodies would indicate?
Right. So once we know if the antibody response that our immune systems make, if we know that confers immunity, then the value of antibody testing to the individual goes up dramatically, because then we can identify people who have not only had the infection in the past, but who would be immune. And that's what everyone is hoping for, that this immune response that our immune systems make will protect us, at least in the short term, from reinfection.
As they work on the vaccine and that sort of thing.
Right, and that's the other. I guess that's really a third bucket of usefulness of this antibody test would be in vaccine trials to identify people who have been vaccinated. You have to figure out if they have generated an immune response to the vaccine, and that could be done by antibody testing.
Okay, and if they do come up with a vaccine theoretically, and they also discover that the presence of antibodies confers some sort of immunity, you could make better use of your vaccine.
If and when a vaccine gets made, where there will be a whole host of new challenges, and that would be distribution and administration of the vaccine. And there won't be limitless doses of a vaccine to be provided. So you would want to use it judiciously, or if you needed to use vaccines judiciously, then you could utilize antibody testing to identify people who don't need to have a vaccine.
Okay, we just have about a minute left here. As we go forward, and as TriCore goes forward, I know you've expanded to regional hospitals and some of the testing capabilities that you have. Do you have enough things like swabs, like reagents? Maybe the reagents are more important for the lab setting, but what does that supply chain look like?
Right. So right now, we are able to meet the demands of testing with the reagents, so the test chemicals that we use to perform the test. But a limiting factor continues to be nasal swabs. So that is the critical piece in the supply chain. Without nasal swabs, we can't do the appropriate collections to do the viral testing. And that's why more attention is being given to alternate types of samples. Can we sample just from the inside of someone's nose? Can we test saliva? Will these be appropriate samples to detect the virus as accurately as we need it to be detected?
So as we all return to work, it sounds like you are still trying to you being TriCore, is still trying to figure out the best way to measure this disease, to detect it, and to provide that information to public health authorities.
Right. We want to be able to detect the virus in people using these alternate sample types if it's possible, but we can't compromise on the accuracy.
Dr. Grenache, thanks for your work and for your time. We appreciate it.
It's my pleasure. Thank you.